Evening with us today. This is our MAPflow Q4 Summit. Our goal here today is really to talk to you about things that matter to you. So what's happening in the country with healthcare, specifically with pharmacy practice, what's going to happen, and how MAPflow is positioned to meet all of those demands and the shift in scope. So we will get started right away. If you haven't already, if you could scan the QR code or visit menti.com and join using the number that appears on the screen there at the very top left, that would be lovely. So I'll give you just a moment to do that. I see that there's a few have logged on so far, but not many. So if you could just scan the QR code or go to menti.com and type in the number at the top, that would be lovely. Just give another moment or two. And really the purpose of having these types of summits, which we plan on doing for our users for the upcoming year, just like we did this year, is really to just outline the expanded scope of Canadian pharmacy professionals and just demonstrate to you how MAPflow is strategically built to support you through this kind of defining moment in pharmacy. And so we'll be covering a number of different topics, but if you enjoy it, please give us that feedback so that we know that we should continue delivering these types of webinars for you. So again, welcome. As I mentioned, we're going to talk to you about Pharmacy Scope, talk to you about how MAPflow is built to support this evolution, and get your input along the way, which is why I asked you to please sign into Menti. This is a 60-minute webinar. We will hold some question and answer session at the very end. So feel free to put some questions in the chat or in the Q&A right now, but we will answer those at the very end of today's session. Where we're at today in terms of MAPflow, we have over 2,100 pharmacy locations across 9 provinces. We have conducted 250,000 patient consultations through you, our users. So we just want to thank you from the bottom of our heart for using us, for believing in us, and for making such a large impact in your communities using MAPflow. We are so very honored and humbled to be, your mechanism and your engine for clinical services. Why does this matter? It matters because we are really pharmacies at an inflection point, and the tools that you choose right now determine whether you're going to lead this evolution or whether you're going to struggle to keep up. So hopefully in the next 45 or 55 minutes, we'll show you exactly why. So I have some of my team members here today. It's not just going to be me speaking. So I have Dr. Kenny Chong, who's pharmacist and the Director of Clinical Innovation here at MAPflow. We have Willow Carmount, who is our User Experience Specialist. We have Mikael Silvestre, who is our CTO and a co-founder. And we have Dr. Mark Gobrand, who is the newest member of our team that I want to welcome here today. And he is a clinical developer and our growth strategist. So all of these individuals will be speaking to you today at the webinar and giving you some of the many things that they're up to and we're up to collectively as a team. So unique insights from clinical, operational, technological sides of our platform. And hopefully you enjoy what they have to say. So here's a roadmap in one breath of what we'll be covering today. We're going to go and high level talk about healthcare in Canada and where we're at right now with a reality check. And then what's changing when it comes to pharmacy practice in Canada, what's new in MAPflow specifically that can help you. Clinical content, what's changed there, and what are the capabilities of our clinical content and where it's going. And then we're going to talk about integration and technical updates. And then we'll end with a Q&A session, as I mentioned. So for the very first question, if you are just joining us now, if you can log into menti.com, if you can scan the QR code, it'll take you there with any device. I would love to get a feel for who is here. What province are you tuning in from? So if you can go ahead and answer that now, that would be great. Again, if you're just joining, go to menti.com and type in the numbers at the very top of your screen or scan the QR code and it should take you there right away. See, a bunch of folks have already responded. Okay. So we have a majority so far, at least those who are on right now, a majority are from Ontario, some are from the Atlantic provinces. And I've lumped the Atlantic provinces together specifically because their scope is so similar that it helps me know, who's who and what's what when it comes to your needs and what you have in your province. So that's great. If you haven't voted and you'd like to, please go ahead and do so now. Okay. Somebody from Alberta? Oh, more Atlantic provinces. It's a little bit late there. Thank you for joining. Majority from Ontario. Okay. That's great. My next question for you. How many minor ailment or common ailment assessments does your pharmacy conduct per week? And this is on average. These are anonymized questions and answers, so please do answer honestly. Just want to get a good sense of where we're at before we get started. So not to judge at all, but just to make sure that what we're covering today is relevant to your actual practice and kind of see where you are all at. Okay. So we have nobody in the over 16 so far, just as an FYI. A lot of folks are in the 1 to 5 and many are in the 6 to 10 per week, which is great. And then a few other outliers. Okay. So what is your goal or your target number of minor ailment assessments for your pharmacy per week? So go ahead and vote on that one. Again, it's completely anonymous. Okay. I don't have 0 in there because I assumed if you're here, you probably have a target that's above 0, hopefully. So that's great. I only see one response over 30. The rest are kind of all over the place. 6 to 10, 11 to 20 seems to be where the majority are at. Okay, great. So why don't we look at this for one moment? The healthcare reality check. Where are we at and why did I say that pharmacy is at an inflection point? The truth of the matter is that 1 in 4 Ontarians are going to be without a family doctor by 2026, which is a month away. That is a staggering statistic. 3 in 4 Canadian adults cannot get the same day or next day doctor's appointment. So they are looking to pharmacists and pharmacies to fulfill their needs for access to care. 1 in 3 avoidable ER visits could be managed by pharmacists with an expanded scope of practice. And as you all are probably very familiar, our ER wait times are very high across the province and across the country. And so this is something that certainly pharmacy is looking to help reduce the burden on the formal healthcare system. So in Ontario here, pharmacists have reached that 2 million assessments since January 1st, 2023 of minor ailments that have been conducted. I just spoke in BC last week, and in BC, they are close to 1 million, and they've had their scope since June 1st, 2023. So these are very large numbers, the impact that pharmacists have had in these provinces. And in other provinces, the Atlantic provinces and Alberta, who's had this scope since 2007, these numbers are much higher. So this is lovely and it's great to see, but I just want you to think for a moment, and I won't let you, I won't make you write anything or tell me what your pharmacy's contribution is of that number. But I want you to consider that and think, how much have you contributed or your team has contributed to making this happen? And why isn't it higher? Just like I asked, what is your target? What is your goal? And why is that not higher? But I do want to stop for a moment and just say thank you. Thank you for doing this. It's all of you who are on this call who have MAPflow subscriptions, who have other, you know, other kinds of priorities in your pharmacy that make clinical services possible. And it's because of you that we've reached these numbers. So I just want to thank you for that. So what's going to happen next? We hit the 2 million mark in Ontario. We're hitting other numbers across the country. Well, the future of pharmacy practice, it's going to require clinical expertise for sure. It's going to require patient care. Everything is going to be patient-centered. And we're going to need accessible spaces, and we're going to need systems that make it all sustainable and scalable. So tomorrow's pharmacy, this isn't what we're talking about the pharmacy today. What are you building today to prepare for tomorrow? What I'm here to tell you is, what this all kind of lies on and what it relies on is having systems in place that allow you to scale your services and to make it a more robust program that keeps your pharmacy operating and thriving. So I put this image up because I love it, first of all, and I think that this is the modern pharmacy. This is where we are going. It's built on systems that will really power clinical services and patient connection more than just dispensing, as we've done for so many centuries. So this modern pharmacy is going to be built on that clinical expertise and accessibility and the patient connection. But what's going to drive it and move it forward and keep it sustainable is the systems you have in place, and whether those systems are helping you scale or whether they're hindering you from scaling. So my next question to you is, what stands in your way of achieving your goal or your target? So if you're on Menti, go ahead and respond to that. I would love to know what your maybe top 3 reasons for not being at goal or target for minor ailments are, or clinical services in general. And a number of you have responded, but a number who are on this call are not on Menti. So if you can join, that would be lovely. So what I'm seeing right away is documentation burden, staffing concerns, and the time per assessment, the time it's taking per assessment. What I'm not seeing a lot of votes on is a lack of clinical knowledge or lack of patient demand. That doesn't seem to be an issue here. Even liability is very low. Profitability concerns, there's a couple. It's really the first 3. The first 3, which staffing concerns are something, there's very little I can help you with when it comes to staffing concerns. However, I will say, when you use a system that has role-based access, when you can enable pharmacy technicians to do certain things within their scope, pharmacy assistants to do things within their scope, students to do things, then the onus doesn't fall just on the pharmacist. The burden is not just on the pharmacist, and you are really taking on this team approach. And when you do that, you're sharing all the responsibilities. And by doing that, the burden on each individual is lessened. And it makes everybody feel more appreciated when they're able to contribute meaningfully and they're recognized for that, but also they're not taking on the entire burden of all the services. So I think, staffing is definitely a difficult one here. However, there are ways of making this a little bit better. Documentation burden, all of you who are voting for that, that's number 1 up there. That's why a system like this is really needed, because it takes that burden away from you and it ensures that you are meeting all the documentation needs that are required from a provincial regulatory standpoint, so that the colleges, as well as the payers, the Ministry of Health, their requirements for payment as well. Time per assessment is certainly something we'll discuss, and I'll show you some of the trends that we're seeing with use of our system. So thank you for that. Thank you for voting on those things. And this is what I want to say. So I see that the majority of you, when you voted that you have conducted minor ailment assessments and you're doing a number every week, which is excellent. Most pharmacists can do this, and most can do, a thorough UTI assessment now that we've been doing it for years. But can you do 15 per week while maintaining the same quality and rigor? Can you do it in 5 or 7 minutes instead of like 15 to 30? Can you document it in a way where you are sure it's audit proof? You're not going to be worried when you have an OCP assessment or an ODB audit, or another Ministry of Health audit from if you are in a different province. And can you do all of this profitably? And I think that's really the difference between dabbling in expanded scope and scaling expanded scope. And that this is explicitly why systems matter in this whole equation. So there's 3 requirements for a scalable practice, in my opinion. And first, it's your mindset, being confident, having structured clinical reasoning. It's not about memorizing anything. It's not about having, a ton of books and going through many, many courses to memorize different clinical algorithms, because the truth of the matter is everything is changing all the time. Clinical practice guidelines are changing. Even the regulations in each of the provinces are changing. So it is difficult to just rely on your memory or on your education to get you through. It's really about having lifelong learning skills and using platforms that do evolve with you and evolve with the evidence. And then that's something that, certainly at MAPflow, we take very seriously, and we make sure it is always the case. So clinical decision logic is built into the system. And what that means is it takes into account all the things the patient is saying, and it customizes or individualizes the care plan that it results every single time. So you shouldn't really get the same exact care plan for a patient with 2 different patients with the same exact condition. It's going to look a little bit different because they have different patient qualities. Some of them, the risk factors for disease are different. And those are the types of things that MAPflow takes into consideration when it creates a care plan for an ailment. There's regulatory alignment here. So, meeting all the regulations, audit-ready outputs for documentation, streamlined workflows. So there's quick ones if you go in pro mode versus standard. We have follow-up protocols now that are automated if you have the pharmacy level subscription. If you don't, you still have follow-up protocols, but usually somebody on your team will have to conduct that follow-up. There's compliant prescribing and documentation, and like I said, scalable team delegation, and really the outcome to have safe, effective, efficient patient care that's delivered every single time, not just when you have time. And so these are really essential requirements if you want to scale your practice when it comes to clinical services, and MAPflow has you covered here. So the answer here is MAPflow. You will get a copy of these slides, so I won't go into detail, but we are seeing that assessments happen much faster when you're using the system. We are down to an average of 4 minutes per assessment when you're in pro mode. And so that increases your efficiency and allows you to deliver more services if you're using this system regularly and you're becoming more proficient with it. Our documentation protects you. We have low risk. Knock on wood, we have not had any issues with any regulatory bodies or any payers when the users are using MAPflow. So that is something we're very proud of. Oh, sorry. Patients trust you when you deliver positive outcomes, which is the result of using MAPflow. We have a 98% symptom resolution rate at follow-up, or significant improvement at follow-up. And so when that happens, when you have a system that delivers those kinds of results, patients trust you. They'll come back for more. They know that they're going to get better when they see you because the care plan you gave them the first time worked. Outcomes improve, and so your patients are going to come back, and teams work smarter, so your capacity is increased. These are our numbers through MAPflow in Ontario specifically. So, we have over 200,000 assessments that have been conducted and over 166,000 patients whose lives have been touched here across Ontario. And that's not just data. That's almost 250,000 moments where a patient has gotten care when they needed it, where they needed it, and it's because of you. And I want you to look at the ailments on the side here. These are 6 minor ailments, the top 6 ailments that are being assessed, at least in Ontario here. And they represent 70% of all MAPflow assessments in Ontario. That's wild. And that tells you and tells us where to focus and where you're already winning. And so if you want to get really, really good at a few ailments and have a big impact, these are the 6 I'd recommend focusing on, because this is what patients are presenting with in Ontario. This is where pharmacies are spending a majority of their time. And again, I want to say, this impact right here, this is you. This is more you than us. Every single assessment here, every patient you've helped, that's your clinical expertise meeting the right system at the right time. And we really just thank you for trusting us to support this work. This is a great amount of impact we're having on our communities, and we're really humbled to be a part of your journey here. So now let's talk about what we're doing to make this even easier for you in 2026. First, if those stats interested you at all that I just presented, we do have a white paper coming out later this month, beginning of next month, that has a lot more data that will be of interest to you. So feel free to, it's completely free to get on our wait list and have this paper delivered to you once it is ready. But it will reveal a lot of insights for pharmacy owners, lots of insights for relief pharmacists, for the pharmaceutical industry, all sorts of stakeholders here. So if you're interested, get on the list and be one of the first that gets this white paper. So before I go into some of the things that are changing in MAPflow and what's new in MAPflow, I just want to show you this one slide here of what's happening across the country. And so regardless of the province I'm talking about, there is an expansion of scope. So in Ontario, of course, we started out with 13 conditions, January 1st, 2023. We added 6 more on October 1st, 2023, and we're getting likely 14 additional ones in 2026. In Quebec, they have Bill 67 that's underway, and that's really expanding pharmacist scope there. They're going to be allowed to assess and manage any condition that's deemed acute. So no lists of meds, no lists of actual conditions, just anything that they subjectively believe to be acute, they can prescribe for, which is exciting. Saskatchewan in 2025, they started strep throat assessments and prescribing, and they also did otitis media, so ear infections. And that's launched initially over just 11 stores, and now it's across 22 locations, and they got therapeutic substitution in the end of this summer. New Brunswick, they have had some setbacks with the clinics. However, they've had more ailments that have recently been added to the list of funded ailments by their Medicare, so their provincial payers. And they're getting an expansion of scope in 2026, and they're going to be one of the only ones outside of Alberta who can have pharmacists prescribing for weight management, including GLP-1s. So that's a huge, huge expansion of scope in New Brunswick. PEI, MAPflow supports all PEI pharmacies, which are about 49 of them, and they have a strep throat assessment that is just launched, and we are launching our algorithm for them the end of November, this November. So they get the point of care testing and the strep throat algorithms all mixed into one, which is really exciting. And we look forward to supporting them and hopefully having this same expansion of scope happen in Ontario in early 2026. So what is this saying at the end of the day? The key insight here, every province is moving towards more and more and more in terms of scope of pharmacists. So that the future is really bright for pharmacy, and the direction is very clear. Whether you're practicing in Ontario, the Atlantic provinces, out in Alberta and Saskatchewan, everywhere you are, pharmacists' roles are ever evolving. So with that, I'm going to turn it over to Willow to walk you through a little bit of some of our exciting features and enhancements to the system right now. So Willow, over to you.
Hi, folks. Thank you. I'm going to start by talking to you folks about MAPflow Academy, which is our comprehensive user-focused hub. So it includes video tutorials, how-to documents, past webinars. So if you're looking to rewatch this one, you'll find it there at a later date, and a small collection of province-specific marketing materials. So our team's working really hard on building a library of evidence-based clinical insights as well, which is where you'll find more information and resources for strep. In the bottom right-hand corner of the screenshot on the screen, you should be able to see a little text bubble, and that's actually our new AI agent. So they have been trained on hundreds of support documents, so they can offer you personalized 24/7 support. Next slide, please, if that's okay. If you're looking to get that support, whether it be setting up your profile, you want help integrating with Philware, or upgrading your subscription, all the answers are in MAPflow Academy, and you can access Academy from the top menu of our website. Plus, if you can't find what you're looking for in Academy, you can always scroll down to the bottom of the homepage. Academy makes it really easy to either submit a support ticket and get help from one of our team members, or alternatively, share your feedback with our team. As I mentioned, our clinical hub is a growing library of insights developed to support you. Next slide. And our strep assessment is not only the first time we're integrating point of care testing with assessments, but it's also the first section in this hub. So we're continuing to publish and reshare resources, whether it be clinical guidance, patient-facing videos, or the new training video that we recently recorded with Abbott, which is set to be published soon, so stay tuned for that. Next slide. Now, I have heard through our support tickets that some users are looking for ways to further increase patient demand, which is why we are really excited to be offering these marketing packages to you. So if you're looking to attract and retain more patients and stand out in this competitive market, then marketing for your pharmacy is incredibly important, as you're all aware. A study in the National Library of Medicine found that marketing efforts notably increase not only the patient count, but actually repeat patient encounters for pharmacies. Next slide. MAPflow is currently offering 2 marketing packages. So the first is our digital marketing toolbox, which provides you with customized marketing content that you can print yourself. So we'll take your logo, we'll take your brand colors, and incorporate that into each of the designs. It is fully customized to your pharmacy. Our full marketing suite, on the other hand, includes everything in the digital toolbox and so much more. MAPflow will actually print that and ship it all to you. So if you're looking to maximize your uptake and you don't want to worry about the hassle of printing, then this is definitely the right package for your pharmacy. Just for attending this webinar, next slide might give it away, but all of you are going to receive 50% off each package until the end of the year. So next slide. If you are interested, or if you just want to learn more, please reach out to us. You can use the email on the screen, support@mapflow.ca. I would love to chat with you about the options that are available, or just hear more about what your pharmacy is looking for in regards to your marketing efforts. And that is all from me for tonight. I'm going to pass it over to Kenny, our Director of Clinical Innovation.
Thanks, Willow. Tonight, what I want to do is just do a quick overview of our current clinical content, including where we're at today, what we're working on currently, and what you can expect from us in the future. And then as well, we have a quick showcase of some of our newer features. So next slide. First, just to give a review or an overview, this is our, or first I'm going to talk about our current algorithm availability. So these categories, minor ailments, these are specific to Ontario's regulations, but most of the algorithms that we have available are shared amongst the provinces and have been modified to meet the regulations of whichever jurisdiction that you're in. So the categories might not apply to you, but the algorithms definitely will. So they may be categorized a little bit differently, but these are the ones that we currently have available. So these ailments, these are the ones, the minor or common ailments that are currently within scope of practice within Ontario. We support all 19 of the current ailments. And on this list, some of the ailments we actually split because they're so large. So dermatitis was split into atopic and contact dermatitis. Insect bites and stings and urticaria were split into separate algorithms. So this list actually has 21 ailments, different algorithms that we support within MAPflow. Next slide, please. So we also provide support for other billable prescribing services that, again, in Ontario are outside the minor ailment program. So including smoking cessation, COVID-19, and influenza. Then we have 9 algorithms for conditions that are part of common ailment programs in other provinces, but would be considered OTC consults in Ontario. So the ones you see at the top right there, headache, seborrheic dermatitis, etc. Some of these ailments we expect to be part of the new scope within a few months in Ontario. So for those pharmacists who are joining us, or the users that are joining us from Ontario, these are actually available right now in our system, and you can actually look at the algorithms um, and practice with them using your demo patient um, to get yourself acquainted or reacquainted with these ailments in anticipation of our expanded scope. And once pharmacists in Ontario are able to prescribe, then the availability of medications will change within the ailment. And then in addition to those, we also have some generic templates to support pharmacists in situations where we don't have a disease-specific algorithm. So we have a generic assessment for acute conditions, a generic template for chronic conditions, and one for our pharmaceutical opinions. Next slide, please. And then for those pharmacists outside of Ontario, who have a broader scope of practice. We have three additional algorithms that are available, including shingles, contraception, and dyspepsia, where that's within scope, you can prescribe for those conditions, and currently not available in Ontario until our scope expands. Next slide, please. Okay, and then we also have several algorithms in the works that we hope to be releasing very soon. The first on our list is acute pharyngitis, which has already been alluded to. Both Nardine and Willa have mentioned it. That should be coming out by the end of the month. And I'm going to talk about that very shortly a little bit more. But then we also have the remainder of our expected ailments for the expanded scope in Ontario: sleep disorders, onychomycosis, warts, dry eye, and otitis externa. And then on this list, we also have one additional condition that is not a minor ailment. So hypothyroidism is going to be our first chronic disease that we are going to release a specific or disease-specific algorithm for, and we hope that will be coming out sometime soon in 2026. Next slide, please. So, so this is just a timeline or a roadmap of where we're at with minor ailments. So for acute conditions or common, the minor or common ailments, we started off with the 19 ailments in 2023. Then in 2024, 2025, we've added more than 20 ailments to our system. And in the coming year, we expect to have at least 7 ailments, or 7 ailments are already in the works and being pushed to the pipeline. And we expect that we will have some more on top of that. With respect to chronic disease management, I'll talk about this a little bit more later on, but we have our generic template for chronic disease plus our pharmaceutical opinion template, and we hope to have some disease-specific ailments coming soon, including hypothyroidism. Preventative care services. So we're looking to expand our algorithm availability for preventative care as well, looking at vaccine offerings, especially pharmacists. We expect pharmacists in Ontario will be able to provide publicly funded routine immunizations, which is already available in other provinces. So we hope to be able to support pharmacist vaccination in that aspect as well. And then later in 2026, we're looking at supporting other pharmacy services for prescribing services such as prescription renewals, adaptations, and other types of therapy initiations. Next slide, please. So we've talked about it quite a bit. We hope to have our acute pharyngitis or strep throat algorithm released by the end of the month. In the coming weeks. And this is an exciting algorithm for us because it's a little bit different from our other algorithms. It includes a testing aspect, which is a little bit unique to acute pharyngitis and strep throat. So so prior to offering point of care tests for group A strep. There is a bit of clinical decision making that needs to be done beforehand. So MAPflow provides that is going to be able to provide that support to pharmacists who want to provide to deliver the service to their patients, and so we can automatically calculate a center score for you based off of the patient's presenting signs and symptoms, and then provide a clear recommendation with respect to testing and what to do moving forward from there. In addition to providing the support for prescribing, such as appropriate agents and dosing, especially weight-based dosing for children. So acute pharyngitis, it's a fairly new disease as part of scope for many provinces, or for many provinces, and we hope that our algorithm will really help streamline this assessment process and give pharmacists the confidence to be able to provide this service to their patients. Next slide, please. Okay, so we have our offering of algorithms is growing constantly, and so in order to help users navigate the ailments a little bit easier, we've created a new display of ailments, kind of new. I think it's been around for a few months now, but I just wanted to cover this to make sure that you're aware of the changes and where to find things as you need them. So when you are starting a new assessment for a patient and looking for an ailment, there are a few ways that you can search or filter for the ailment that you're looking for. We have an instant search box where you can type in the ailment name, and then it should come up for you. Or you can filter the ailments by various headings. So we have our clinical streams, including acute, chronic, and prevention. We have body system chips where you can select a body system to look for ailment. Plus we have the actual ailments are in color-coded tiles to help you recognize them, but then also at a glance understand what programs they fall under with respect to reimbursement, to help manage your workflow and your prioritization. So next slide, please. Now when you're selecting an ailment selecting an ailment for a new assessment, this is the page that you'll land on. It may look a little bit different depending on your province. Some of the categorizations may change based off of your province, or some of the coloring of the tiles might change based off of the reimbursement structure within your province. If you want to click noting, there's a few animations here. Yeah, so at the top here we have our clinical streams, so the acute, chronic, and prevention. Then underneath that we have our body systems. So you can click on any of those tiles, and so if you're looking for, let's say, thrush, you can click on mouth, and that will filter out your conditions so that you can find what you're looking for easily. And then one more click. Yeah, then we have our color-coded tiles, which those are our ailments or our algorithms, but they're color-coded based off of the program. So blue would be your the minor or common ailment program within the province, where those ailments are reimbursed by the ministry. Green is reimbursable assessments that are outside of the minor or common ailment program. And then that yellowy orange is ailments that would fall under an OTC consult within the province. So it's not a part of the common or minor ailment program within that jurisdiction, but that's a service that pharmacists can and do provide. So assessing patients for something like headaches. And so you can still use our algorithms to provide that decision support and recommend a product, an OTC product for that patient that's evidence-based. Next slide, please. So that previous slide, that was looking at our acute conditions, so conditions where we would expect to treat the patient, and the patient signs and symptoms would eventually go away. Prevention, so this is the treatment of a patient before a certain condition is met. Under this arm, we have contraception, emergency contraception, and Lyme disease prophylaxis. And so, I mean, we had some questions about where the tick bites go, and it moved under this prevention arm. It really falls under prevention because we are prescribing for prevention of Lyme disease. Next slide, please. Oh, I rearranged some of these slides and then make it to the cut. Okay, so we'll jump around a little bit. It's okay. Looking at some of the recent features that we've implemented, just wanted to highlight a few of them to make sure that everyone's aware of them and taking advantage of them. So Nardine talked about looking at improving efficiency of your services, making sure that you can have that capacity to provide lots of services, especially if you're finding time is a barrier for you. So one of the newer features that we've implemented, and this is available for those of you who have a per pharmacy subscription, is patient-led follow-up. So instead of having the pharmacist or someone on your team call the patient or have setting up an appointment where the patient has to come in so that you can reassess them to see how they responded to therapy, we now have the option of sending the follow-up to the patient either by email or by text message. If you click, Nadine, I think there's a thing here. Yeah, so there's a button here. You would see this on your dashboard. So if you're looking for an assessment to do follow-up, there's a button here where you can actually send this follow-up to the patient, or if you've selected it within the algorithm, you said you would follow up by text or email, it would do it automatically when the follow-up was due. If you click again, so clicking on this button, it'll allow you to enter in the patient's email or phone number so that you can text them or send them the link so that they can do their own follow-up. And so we've started to have a great uptake of this feature. It saves pharmacists and pharmacy teams a lot of time to have the patient answer their follow-up questions on their own time. And then once they're done, the pharmacist is alerted when the assessment is complete. We have two types of notifications. If the patient reports that all of their symptoms have resolved and they have had no adverse effects to therapy and no red flags have emerged since they last saw you, then the pharmacist will just get a notification that follow-up was complete. You can review it if you like. Otherwise, it just gets those responses get recorded in the patient's profile. Otherwise, if the patient identifies that there's a need for further intervention, so some lingering symptoms or some adverse effects, then the pharmacist will get notified that they should follow up. We also have this patient self-intake feature now. This is available to all subscribers, so individual or per pharmacy subscriptions. If the patient is new to your pharmacy or they haven't had an assessment through MAPflow before at your pharmacy, while they're waiting for the pharmacist, they can actually invite them, or they can actually fill out their profile themselves, their demographic themselves. So if you click Nardine, there should be there's the button for invite patients. So someone on your team, your pharmacy assistant or technician, can click on this button. Similar to the other window, you can enter in the patient's phone number or email address, and they will get a link to fill out their own demographic, saving your team that time so the patient can do it themselves while they're waiting. Okay, next slide, please. Okay, pharmaceutical opinions. So this is another a feature that we've included recently, where we have a template for pharmaceutical opinions. And one of the things that we tried to stress while creating this was making the documentation clear and usable and supportive of collaborative care. So once you've gone through the template, it'll prompt you with questions of what's the medication in question, what is the issue, and entering in your justification, and then that will create the documentation for sending off to the original prescriber with a clear form of what the prescriber needs to do so that you get a better response rate so that you can bill for those pharmaceutical opinions. Next slide. Okay, so jumping back here, we missed this. This slide fell out of order here. Our chronic disease management, our clinical stream here. This is our third stream here. So right now we have our two generic assessments right here, one for chronic diseases, one for pharmaceutical opinion. And we hope that in the future we will be adding to this with disease-specific algorithms, starting with hypothyroidism. Next slide, please. Okay, and then our generic chronic disease management template. This template, again, if you attended our last webinar, we talked about this. Just as a reminder, this template is there to help you create an ongoing care plan focused on a single chronic condition. So this is especially useful for situations where you expect to follow a patient's condition regularly. MAPflow has worked a lot of efficiencies into this template where once you've created an initial assessment and that patient returns for follow-up, a lot of that information that we expect to stay the same on a ongoing basis will be copied over from your previous assessments. So the generic template allows you the flexibility to apply this workflow to any condition, supported by some of our special features that help ensure your care plans are consistent and comprehensive without being too onerous on you as the user. And as we mentioned, we hope to have some condition-specific algorithms available soon for chronic disease management. And next slide. Yeah, so as part of our chronic disease management algorithm, we have helped to organize the documentation so that it's very clear at the end of that assessment what the patient is going to do. And so this is helpful for anyone who needs to look at this, the pharmacy team, the patient, or the primary care provider. And this is just a snippet of the documentation, but looking at the plan, it's very clear for the patient, what, with respect to their therapy, is what things they need to continue, what they should continue. If you've made any changes, what things should be stopped and what things should be started. And then other recommendations based off of the discussion that you've had within that assessment. Next slide. Okay, and so with that, I'm going to hand off to Mark. Very excited to have him on board. It's I think a testament of the growth that we have him with us. So we're glad to have him on board.
Thank you so much, Kenny. So just want to touch on a few things. The main focus with our disease-specific modules in terms of chronic disease management is simply just to make the assessment and follow-up simple and seamless, whether it's reviewing the patient's blood pressure trends or following up on their TSH levels. The hope is it feels intuitive, efficient, and clinically meaningful. We're also looking at exploring how AI can fit into this space, not as a replacement for pharmacist judgment, but as a new way to surface insights, flag trends, and reduce the mental load that comes with managing complex patients day to day. Think of it more as technology that supports your clinical reasoning, not replacing it. So I encourage all of you, if you have any ideas, any wish list features, reach out to me. My email's on the screen. I'd love to hear from you, just so we can make sure we're building tools that truly make your day easier and your clinical impact stronger. With that, I'm going to pass it over to our team. She's going to take you through a quick poll to see what features should be at the top of our priority list.
Thanks, Mark. Yes, so if you haven't already, please scan that QR code or go to menti.com. I think there's already people who are voting on this one. I just want to know what your maybe top 3 most important features to your practice are right now. Is it to have deep prescribing algorithms added, more OTC consults, more minor ailments? Is it chronic disease management algorithms? Is it enhanced reporting and analytics, dashboard enhancement, medication review or meds check, documentation integration, more marketing resources for your pharmacy? Or if there's other, we'll take that in the chat. So I see that a lot of you have voted. Kenny, you'll be pleased to know minor ailment prescribing algorithms and chronic disease management algorithms, Mark, are the highest on the list. Medication review documentation is as well. Vaccines, deprescribing a couple. Pharmacy marketing resources, yes. No one for enhanced reporting or analytics, which is great. Oh, maybe one. All right, great. Please keep voting on that. I will just go quickly to the next slide and ask for what system are you using? What PMS are you currently using in your pharmacy? Okay. And go back to this one. Okay. Large crawl user base. Propel, Philware. Okay, those are what I'm seeing mostly. Great, thank you so much for that. So with that, I'll turn it over to our CTO, Mikhail, who's going to quickly talk about some integration and technical updates before we open up the floor for more questions.
Hi, everyone. Thank you. Thank you, Nadine. Can you just move to the next slide? Perfect. So I just want to summarize quickly what we have as integration and partners at the moment in MAPflow. Most of those integration are already used by many of you guys, but just in case, the main one and probably the easiest one to achieve is a CPS integration. We know that many of you have a CPS account, and it's very easy to link to your current subscription in MAPflow. Everything that is there, by the way, can be found and explained in the Academy. So Willow explained how to find any resource. You can just go on the Academy, just search for any of those integration, and you will find the solution right there. If for some reason you cannot find it, you can always send to support. So CPS integration is number one. PMS, we have full integration with Fieldware and Box Labs, which means reports, documentation, everything is coming back to the PMS. We have what we call a partial integration, which is a way for you to import your patient from Chrome and Propel RX at the moment. Scheduler systems, we are fully integrated with MedMe and Medisys. And as well as for Fieldware and Box Lab, the documentation is flying back as well to those systems. eFax module has been implemented now for the past 3 months and is available for pharmacy subscribers. It's a free module and allows you to send notification to the doctor right from MAPflow. No need to print, no need to scan. It's just right there for you. And last but not least, Meds on Wheels integration, which is basically a way to deliver conveniently drugs to your patients right from MAPflow as well. It's using the Uber delivery system. So if you can order a pizza with Uber, you can also deliver drugs in your pharmacy. Next, please. So this is what we have as integration. What's coming now is more integration, more systems. So we are excited to somewhat announce that we are working with major PMS right now to allow MAPflow to integrate fully as well. We cannot announce exactly which one, but if you think a little bit about it, you might know. It's hopefully going to come in the first quarter of 2026. As Mark mentioned, we're trying to see where we can put like some AI technology and support throughout MAPflow and from AI scribe to clinical assistance. This is also coming next year. Concierge services, just to allow you to add more services to MAPflow that we are not supporting, such as, for instance, ED or weight management or even compounding. A very interesting feature that everyone has been requesting is also a way to delegate the first step of our assessment to the patients. Right now, you can delegate to technician, assistants, so all your team can actually do this step, but why not the patients? So we're also working on this, And our biggest challenge now is just to make sure it's as easy and as simple to use as possible. And as we've seen before, many new algorithms are coming. The next, please. One of my new feature that is actually very exciting for me is to show you how we've changed the workflow in MAPflow. Next. So thus far, what if you're a MAPflow user, you know that at the end of the assessment or the service, you would land into the prescription. And from there, you had a few options to open different reports. It was not very easy to find. And we've been told by many of our users that they didn't even know that there was a notification report, for instance, or a patient report. It was just not quite right there. Next. So what we've said instead is just changing completely the way we're going to land and to look at the assessments. It's what we call like the overview page or the summary page. So the page we've seen before, now let's try to zoom in a little bit. So we have what we call like the service, for instance, summary, where you can see the patient information, you can see how the service was conducted, you can see the billing ping, the phone notification information. So everything that you need to see at one glance is readily available. Next. What we also saw in the screen before was a summary of all the therapies that were selected in the system. So prescribed therapies as well as recommendations are also visible automatically. Next. The most interesting feature for me is actually that you can now see all these documents that we're creating. Before, it was a little bit hidden and not always easy to find. Right now, in this new implementation, which is going to be released probably at the end of November, you can see a list of all the documents that are created specifically for your assessments. So a list of, in this case, you have prescription, notification, patient report, etc. So for each document, next, you have different actions that you can actually perform. So for instance, for all documents, you can always download the PDF. Before, you had to open the document, you had then to open the preview, and you had to download like 3 or 4 clicks just to actually get the PDF. Next. What we also have is document-specific actions. So in this case, for instance, the physician notification can be sent by eFax automatically. Well, it's right there. So many people actually told us they didn't know this feature was available. It's now in your face. You cannot miss it. Next. We also have is also a specific action for the patient report. This one is going to send the patients a report by SMS or email using exactly the feature that Kenny described before. Next. And obviously, if you want, you can open the report as before. You can just, if you actually want to see what's being created, it's right there for you. But you don't have to. What's very interesting here is if you want to download the documents, you have everything available in one click. So if you look at this page more in details, in this case, I have selected the prescription, the patient report in 2 languages, English and French, and the pharmacy assessment record. So that means I have 4 documents that were selected in one click. By clicking on the button above, like download selected, I will be able to get either like one PDF with all the documents or a zip archive with each single documents. Whatever you select here is also going to be saved in your profile. That means that next time you do an assessment, it's going to be your default setting. That way, saving even more click. And lastly, this is also the information that's going to be sent to your PMS or your scheduler. So thus far, we were always sending the same amount of documentation, and maybe it's not what you want to save in your pharmacy. So now you have full control to decide what is going to be sent and saved in your system as well. Next. Back to you, Nadine.
Thank you. So perfect timing. So with that, I want to wrap it up with one last polling question. We just want to know what your preferred mechanism is for notification from us about any platform features that are new. So, we've released so many over the past year, and some of our users are like, oh, I didn't know that was available. And so we just want to know what is the best way to reach you or to let you know about these things. So if you can vote on that, that would be greatly appreciated. And I see that email is really high up there, and some video tutorials on Academy are also really high in there, are really getting a lot of votes there. So that's great. Wonderful. Well, thank you for that. And in closing, I just wanted to say that, again, pharmacy is at an inflection point. These are the three things I want you to remember from today, if nothing else. Our scope is expanding faster than ever, and the tools that you need to keep pace are going to be more and more important. And so MAPflow is built specifically to help you scale, not just comply with local regulations, but to scale and to really create a pharmacy that is not just doing well, but really enhancing their growth year after year. Your feedback today directly shapes our 2026 roadmap. So please provide us with that feedback, and thank you for all that you do to, help the communities, to help us provide what you need to grow. And lastly, please don't hesitate to reach out to any of us if you require some support. I see in the chat, Lauren, we really appreciate your feedback. You're always very, very, very critical and very detail oriented, and you know exactly what you need, and it's really helped tailor our approach as well. So we love feedback like that. So please do that. Thank you, Mona, for your comment there. So with that, I will turn it over to all of you for any questions you may have. And thank you so much. So I will look at the Q&A. I don't see anything there. I do see one in the chat. When is the feature that allows delegating? Thank you. So when is the feature that allows delegating the collect step to the patient expected to be released? We don't have an expected release date yet. This is a bit more complicated than initially, intended, because we are having to translate all of that into grade 6 reading level for health literacy concerns for patients. So it's taking a little bit longer, but it is certainly top of our list of priorities for 2026. So hopefully you will hear from us that will be available sooner rather than later. Any other questions or thoughts? You can put them in the Q&A or the chat. Team, is there anything else you want to share with everybody who has still stayed on? I know we're 2 minutes over. Lauren asked, will there be an OPA course on the minor ailments? I'm assuming you're talking about the therapeutics for the new ailments, and there is not going to be a course yet that I have heard of, and we are obviously, OPA is a partner with MAPflow, and so no, nothing on the horizon yet. We still don't know which of the 14, if all, will be added to scope in Ontario. I'm sure there will be continuing education available both from other providers, potentially OPA and MAPflow as well. Academy will host a lot of content that will help support educational needs for any of the new conditions. Thanks, Karen. Anyone else? Nothing else? Well, thank you all again for spending your evening with us. The recording will be available on Academy, and the resources that we'll discuss, those are all available on Academy. If you are interested in having a marketing package for your pharmacy that is co-branded with your pharmacy and MAPflow, please do reach out to us as well, and make use of the 50% discount from now until December 31st. And we look forward to seeing you at our summit in Q1 of 2026. So thank you all. Have a wonderful rest of the day and year. Thank you.
Thank you.
Thanks, everyone.
Thank you, guys.